Hi, everyone. I'm Erica Villa, and I work for Nextdoor Solutions to Domestic Violence as a Community Prevention Manager. In this module, we'll talk about how physicians can be allies to survivors of intimate partner violence. Joining me for the discussion is Dr. Sindhya Rajiv. Welcome.
Hello, I'm Dr. Rajiv, an emergency physician at Stanford University. I look forward to discussing how physicians can be important resources and allies for survivors.
A quick reminder before we start.
Given the sensitive nature of this topic, we recommend using the following additional safety steps if you might be at risk for intimate partner violence. 1. Find a safe and private space to listen. 2. Please use headphones to listen to this video. And 3. Pull up another website on the latest news or some random web page so that you can easily change tabs if anyone approaches you during this video viewing.
Also, please remember that your internet history can be monitored. So please clear your browser history and your YouTube history after viewing this video. In the show notes below, there is a link to instructions on how to clear your browser and YouTube history, and a link to a new website to escape to it if needed.
While we will talk a lot about healthcare, this video series should not be used for personal medical advice. If you're worried about your own health, please talk to your doctor who knows you and your medical needs best. We may also talk about legal issues that have come up during the pandemic. Our aim will be to make you aware of these, but once again, you should talk to a lawyer if you have any legal concerns of your own.
And lastly, we have no financial conflicts of interest to declare. In this module, we're going to focus on survivors of intimate partner violence and what they can expect when speaking to a doctor or medical professional. We will also explore how they can be strong allies to survivors and some common concerns people may have related to visiting an emergency room or a medical clinic.
That all sounds great. Let's jump in. To begin, what we in healthcare, your doctors, your nurses, your social workers, want you to know first and foremost is that we are here to listen and provide survivors with resources and connections. Even during the COVID-19 pandemic, when many other things are shut down, when hours have changed, or when you don't know where to go, we in the emergency department are still here whenever you need help, 24 hours a day, 7 days a week. We have legal duties that require us to report domestic violence and physical injuries, but we seek to do this in a way that is safe and empowering for the survivor.
Now, to better understand what survivors of intimate partner violence can expect when speaking to a doctor, let's go through a scenario. Imagine Maria, a 32-year-old woman, is in a relationship with a partner. The pandemic has been very stressful for them. They both lost their jobs and are separated from their families. At home, arguments have gotten worse, and sometimes Maria's partner gets violent. One night during an argument, Maria's partner becomes physically violent and she fears her wrist may be broken. The next day, the pain in her wrist has worsened, so she goes to the emergency department. Dr. Rajiv, what can Maria expect once at the emergency department?
In most emergency departments, every stable patient is asked health screening questions where the nurse or other medical professional asks about mental health and personal safety concerns, including intimate partner violence. However, if Maria visits the emergency department only for COVID-19 testing, it is very likely that she will not be screened for intimate partner violence. Healthcare professionals are mandated reporters in many states in the US, like in California, which means that if a doctor, nurse, or medical professional knows and/or suspects that their patient is experiencing physical violence from a partner and treating an injury due to this violence, they are required to report it to the police.
When the medical professional asks Maria the screening question, "Do you feel safe at home?" Maria feels the need to protect her partner and responds, "Yes, I do."
Later, the doctor arrives to see Maria and asks further questions to find out what happened to her wrist.
Maria feels nervous and is still trying to protect her partner, so she tells the doctor that she fell down the stairs.
This seems very reasonable, but when examining her wrist, the doctor notices that Maria is very anxious and worried. The doctor becomes concerned that Maria's injury may have been caused because someone hurt her and not from a fall. The doctor explains she won't share anything talked about today outside of the care team here, unless Maria were to tell them about abuse related to the injury. Then by law, healthcare providers are required to report instances of abuse. The doctor also explains that Maria is not required to disclose the name of the person who abuses her to a social worker or police, or file a report herself. The doctor provides Maria with resources on relationships and information for safety and health in case she needs help, resources that she shares with all patients. After hearing what the doctor has told her, Maria tells her about the argument between her and her partner and how she really got the wrist injury. The doctor thanks Maria for sharing about what happened and expresses that she is sorry that this is happening and that no one deserves to be hurt. The doctor also shows support by sharing that other patients also experience things like this, and Maria is not alone.
What happens next?
While Maria continues to get medical care for the injuries, a social worker or other healthcare professional will come speak to her about resources and will then file an incident report with the local police agency.
What if Maria's partner who abuses goes with her to the emergency department? How can she feel safe telling the doctor or medical staff the truth?
Nurses, doctors, and all other medical professionals should ask questions regarding patient safety and possible partner abuse when the patient is by themselves. Please know that your patient rights include the right to personal privacy and to receive care in a safe and secure setting. If the partner who abuses is with Maria, they will be asked to step out of the room before she is asked screening questions about intimate partner violence or abuse.
That is really good to know that healthcare providers will try to ensure privacy for the patient. Another question: what if Maria is unable to go in person to see a doctor but wants help?
Telehealth is an option for her. Anything discussed during a telehealth visit is not shared outside of the treatment team unless required by law to report abuse. But unlike the emergency department, all telehealth visits may not include a screening of intimate partner violence questions, and the doctor really has no way of knowing if the partner who abuses is in the same room with Maria. If possible, Maria can take the call outside the home or use headphones when the doctor is speaking to her.
Yes, that really is such important information to remember. Some people worry that going to the emergency department might affect their ability to become a US citizen or get a visa or a green card.
Let's talk about this for a moment. First and most importantly to say, your healthcare team cares about your health status, not your immigration status. Health workers should not ask for immigration status information. Emergency departments will treat you regardless of insurance, money, or immigration or citizenship documents. Secondly, this fear of visiting an emergency department is usually related to something called public charge. Public charge is a cost the federal government looks at when they're deciding whether to grant someone the right to live and work in the US. The cost the government is trying to decide is how much support and resources will we need to give this person. We are not qualified to give legal advice, so we won't go into those details. But if you need specific immigration help, you should contact your lawyer or a legal aid clinic. And all persons under age 21, pregnant people, and new mothers can use Medicaid without worrying about public charge, regardless of whether they are pursuing a special immigration status.
Okay, so let's wrap up by quickly reviewing what we've learned. When visiting the emergency department, patients will be asked health screening questions about their safety at home. Also, in many US states, healthcare providers are required by law to report if they suspect their patient is experiencing physical violence from a partner and treating an injury due to this violence.
Yes, and healthcare providers should ask anyone who is accompanying the patient to step out of the room when discussing safety concerns and examining the patient. And finally, the emergency department is open 24 hours a day, every day of the week.
Thank you all for spending your time today learning the different ways that physicians can be allies to survivors. And we hope this information helps people access the care they need.